You're welcome to day 3 of medical terms and their meanings with AlphaMeg. And the word for today is diarrhea. What is diarrhea? Diarrhea means having a loose and watery stool, which is characterized by using the toilet and passing out feces 3 or more times in a day. Now, what are the causes of diarrhea? Now, these are some of the causes according to research and studies. Viral infections is the most common cause. Stomach flu like the norovirus and the rotavirus can cause diarrhea. The one that we are common with here is the bacteria and parasite causes. Yes, often from contaminated foods and water or water. Yeah, where you get some things like food poisoning and equally contaminated water. Medications too can cause it. Yes, there are some medications that could cause diarrhea. Like some antibiotics, some antacids, and chemotherapy. During chemotherapy, some drugs then could cause diarrhea. You know, and here is something some of us could relate to. This is the dietary issues. Yes, for those of you who are lactose intolerant, let me give you an example of those who are lactose intolerant. If you or you know someone who consumes milk, whenever this person consumes something like milk, they complain of, stomach pain and they are using the toilet frequently. That person is lactose intolerant. Well, not just limited to milk, you understand. Exactly. So that is one of the causes. And diseases, yes, like Crohn's disease, ulcerative colitis too could cause it, as well as other gastrointestinal issues. Yeah. So how can you tell if you are experiencing diarrhea? Well, here are the things you can look out for. Look out for loose, watery stool if your stool is not really solid, more of semi-solid, often liquid form. Yes. Abdominal pain and cramping, that's a sign. And when there is an urgent need for the bedroom, you just came out and now you're running back in, that is this. Nausea and vomiting too could be one of the cause. Yeah, and one of the symptoms, actually, one of the clinical manifestations. So you want to look at that. And fever, yes, due to certain infections. If it is caused by an infection, you feel that. And if the whole thing equally results consistently, you'll feel feverish. Yeah. So, the duration and how long does diarrhea last? Well, for some individuals, within that same day, depending on whatever is the cause, it could be relieved within the same day or within a few days, it will be over. Yes. And if this diarrhea lasts for more than 2 weeks, it becomes a chronic condition. And at that point, we would advise you, please, before then, get a health practitioner to check you out. Go and see your doctor. Let them know what's going on with you. All right. So how do you treat this? Well, there are home remedies, some things you can do on your own, like drinking plenty of water. Yes, because you are losing a lot, so you have to replenish that. Drinking plenty of fluids, water, broths, and electrolyte-rich drinks. Yes, would help. What about diet? Yes, follow the brat diet. Brat diet. We have banana, rice, applesauce, toast, depending on where you are, what you eat, just eat something that is at least rich in fiber that can hold your system together. For medications, please, we will advise you to go and see your doctor as prescribed. It will really help. All right. And, you know, they could recommend some oral rehydration therapy for you. Yeah. So there could be some you could do by yourself at home, and there could be those you would require a health practitioner to help you out with. So that's what we have for today on diarrhea. If you enjoyed this video and you know someone who is prone to experiencing diarrhea, please send this video to them. Let it reach as many people as possible. Leave a like, follow us on Instagram, Facebook, TikTok, and equally YouTube as Alpha Tutors. See you on the next one.